back. This is BoomerLife on CL 650.
And welcome back to Boomer Life on CL 650. I'm Joanne Sutton, and today we are joined by an expert panel representing the Alzheimer's Society of BC. In this segment, we're going to find out a little bit more about Alzheimer's clinics in this province, and we will talk about some of the research that's currently being done with our special guest, Dr. Håkan Nygård. So, Dr. Nygård, thank you for joining us today.
Very happy to be here. Thank you for having me.
Thank you. A little bit about Dr. Nygård's background. His work in Alzheimer's disease is actually increasingly gaining international recognition. He's a past faculty member at Yale University and is now Fipke Professor in Alzheimer's research here at UBC's Faculty of Medicine. It's a role he's been in for nearly a year. Dr. Nygård has studied connections between epilepsy and Alzheimer's and was the founding co-director of Yale's Memory Disorders Clinic. In his current role with UBC Centre for Brain Health, he sees patients in both the Alzheimer's Clinic and at the UBC Hospital while conducting research in hopes that research findings may one day translate into treatments. Can you just tell us, Dr. Nygård, what an average day looks like for you? What do you do in an average day?
Well, it depends on the day. I have an Alzheimer's clinic or dementia clinic at UBC half a day a week. And the rest is really designing and implementing research. And what I do is mostly what we refer to as preclinical research, which is modeling Alzheimer's disease and other dementias in the laboratory. And we also design early phase human trials. And the idea is to translate these preclinical findings into treatments for people with Alzheimer's disease.
How did you first become interested in such a specific area like Alzheimer's?
Well, I had the good fortune of working with a physician in medical school who saw people with dementia, and I quickly found out that I really enjoy working with that patient population. And sometimes you have to just take a chance, and I certainly did on neurology, which is the study of the brain, and dementia, working with older people, and it really has resonated with me in my professional career as well.
Excellent. So you work directly with people that have dementia at the Centre for Brain Health. Can you tell us a little bit more about the actual role of these Alzheimer's clinics?
Well, I think our most important role is to establish a clear diagnosis. I think oftentimes people have cognitive difficulties, they may have some problems with memory, and it's very important to get an accurate sense of what is going on. Sometimes nothing is going on, and other times it's the early signs of a progressive disorder such as Alzheimer's disease. And I think our role is to really clearly define the process that's ongoing, which can be very complicated.
Absolutely. So what areas in particular are your various research projects focused on? Like, how specific are they?
Well, we have several ongoing projects. I think our most exciting effort is a collaboration now with CIHR, which is the primary funding agency for research in Canada, to try to create what we call a pipeline where new drugs or new discoveries that are made in the laboratory make their way to a person in a clinical trial. So CIHR and other agencies refer to this gap as the death valley because so many discoveries are being made in the laboratory. And as Jim, we had this discussion before coming in here, there's a lot of press about these discoveries, but many of them don't make it into a person as a treatment. So that's what we're trying to do. We're trying to take a drug, accelerate the process, and make it into a clinical trial in people. And we have several interesting compounds that are being developed at the moment. The one that I'm mostly involved in is a drug that was originally developed for cancer, and it was shelved by the pharmaceutical company that made it, meaning that it wasn't developed anymore for cancer. We defined a mechanism where it might be used in Alzheimer's disease, and we very rapidly took that drug through a preclinical testing phase, which means the laboratory, and we now have a large multi-site clinical trial using this drug in patients with Alzheimer's disease. So this can be done. We can bridge this gap, but it takes effort, it takes expertise, and of course it takes appropriate funding.
Absolutely. And you obviously don't work alone. You must have a team of experts that you work with.
We have an international recognized team at UBC which is led by Dr. Howard Feldman, who's been in the business for many, many years. And we have a wonderful research team that is very experienced and really ready to make this happen.
So you mentioned that you just recently found some, I guess you made some progress with this, a drug that was initially used for cancer. So can you give us another example of how you've taken the scientific background and actually found some positive direction from that?
So there are many examples. Another one is we discovered, and not just we, other laboratories as well, discovered that models of Alzheimer's disease often have seizures. And it turns out that patients with Alzheimer's disease have an increased risk of seizures as well. It's not very big, but they do have an increased risk. And drugs that are used to treat seizures can also be used for Alzheimer's disease. And this was an idea that was born out of preclinical studies in models and has now undergone 2 clinical trials in human subjects with Alzheimer's disease.
So are you just involved with purely the scientific research side? Are you actually involved with administering the clinical trials with humans?
So I do both,
Okay.
which is the benefit of having a medical degree and a PhD, in that I can live in both worlds. So that has been the difficulty, again, to take a medicine that was developed in the lab and give it to a person. And that's really what we're hoping to do at UBC, and that's what I'm hoping to contribute by being there.
And you're giving us all hope.
Well, we in the field are very hopeful. I think that we have to recognize that it takes time. We have numerous new drugs that are being developed in humans. And as we have alluded to previously in seminars we've given and talks, we'd like to tell the public what's going on. And every year there are interesting findings from clinical trials. And I would say over the next 5 years, there's going to be a wealth of trials that are finishing, and we will have a lot of information about ongoing treatments and whether they might be effective. I think that all of us believe that there will be an effective therapy, but we also realize that it may not be a single therapy that's going to be effective. And I liken this sometimes to the way we've ended up treating HIV, which is the virus that causes AIDS. It's not one drug that works for AIDS, it might be 4.
It's a cocktail.
It's a cocktail, and I believe that that's where we're heading with Alzheimer's disease too. So for example, exercise, which is getting a lot of press, may not work. Many people who exercise plenty still get Alzheimer's disease. It doesn't, we're not going to do this with one therapy, but every patient can have a tailored therapy using multiple different approaches, which might be, at least we hope, effective in the not too distant future.
And Jim, we were having a conversation earlier about your perception of the research that's being done. And
yes, I understand and believe strongly in the research. I think what we have, and excuse me, what is not necessarily appreciated is that there are the 2 streams of research, one being the medical and one being the quality of life. And my view is, I guess, a very personal, very selfish view of medical is that it's not helping me today, whereas the quality of life research does help me today, or has the potential to help me today. And I think both of those streams become very, very important for the whole journey today and the long term in trying to prevent, eradicate whatever dementia, Alzheimer's, but understanding how best to deal with some of the living circumstances, I think, is also very important in research.
so how do you actually translate the research that you found to a patient such as Jim?
Well, I couldn't agree more, by the way, and certainly our group at UBC couldn't agree more either. And there are 2 branches of studies. One is exactly that, try to improve quality of life. And one prime example of this is Dr. Chung, who's doing music therapy to try to help behavioral difficulties with people who have Alzheimer's disease. But from my perspective, I take the long-term approach. So I believe that if we find an effective therapy now, then that will help your fellow perhaps in 5 or 10 years. It may not be an immediate impact, But that's ultimately what it's going to take. We need a therapy that will halt the progression or maybe even reverse it in order to alleviate all the downstream effects. But I do believe that both are very, very important. But my focus is really on finding a therapy that reverses the progress.
I think, Joanne, the other thing that is really important from the Alzheimer's Society's point of view is bringing the dialogue together, so bringing the groups together, the researchers and people who are living with Alzheimer's and their families. And so we play a real important role in bringing together focus groups to help the dialogue so that the two groups who are experiencing both sides of the puzzle, which are so necessary to bring together, can have that dialogue. We also are very supportive of the Alzheimer clinics at UBC, especially because their physicians will refer people to our First Link program so that families can get the help and support they need and become participating in that education.
Jim, have you participated in the clinics at UBC?
I have. I went out there initially after my earlier diagnosis and went out there for a few years. I don't any longer, but I find the trek from Surrey to UBC to be extremely long, and I don't drive, so it's up to my wife to get there, and so.
Excellent.
It is a good. It certainly is a beautiful facility, especially now with the opening of the Brain Research Center.
It is a very nice center, yes.
Is there any final words you would like to offer us?
No, I would like to say to Jim, in response to this idea of engaging the public, and to Maria's point as well, our collaboration with CIHR really focuses on this concept of patient-oriented research, which means that people have input, people who are living with this disease have input in terms of shaping the research program. So we are trying to develop therapies that not only address what we think is important, but really take into account what patients and people who are living with this condition think are important. So I just want you to know that we're working on this issue very hard.
That is an important point.
Dr. Nygaard, thank you very much for your comments. We have been talking about Alzheimer's disease and dementia with Dr. Håkan Nygaard on BoomerLife here on CL 650. There's a lot more to come on today's show, including how you can get involved in the community and a chat about events and the fun part of fundraising for the Alzheimer's Society of BC. That's coming up next on BoomerLife.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.